Hello. In our community dialogue, let's talk about prescription drug abuse and use. My name is Michael Davis, and I serve as the Associate Executive Director for Prevention at GUIDE. Just a little bit about GUIDE in case you don't know about us. We are a nonprofit based out of Gwinnett County, Georgia. We do positive youth development and prevention work, primarily as our two big buckets of work. We are staffed in those two areas. We run a flagship program called Georgia Teen Institute, which this year was canceled or changed or modified, however you want to say it, to GTI University, which we are finishing up now. Many of people on this call are part of GTI University, and we want to thank you for doing that. Being part of that. And then in our prevention work, we do work around underage drinking prevention, vaping and tobacco use prevention, suicide prevention, and of course, prescription drug abuse and misuse. So we're very excited you're all here and joining us today. I have the honor of introducing you to our panelists, and I'll give them a moment just to talk about themselves and their agency and introduce themselves here in a moment. But we have a great group, and we want to thank all of their agencies for allowing them to be on this call and for all the great work they're doing in our community. So starting with Amanda, will you please introduce yourself for us?
Sure. Hi, everybody. I'm Amanda Stripmatter. I am the program manager for Safe Harbor, which is our addiction recovery support center for Navigate Recovery Gwinnett. I am also a person in long-term recovery from addiction. Thank you.
Thank you. Diana?
Hi, I'm Diana Plazas. I'm the project coordinator, project director of GenRx, Generation RX, and I'm working with Viewpoint Health specifically.
Thank you. And Morgan?
Hi, my name is Morgan, and I am a guide yapper. So I go to North Gwinnett High School, and I'm a senior, and I also participate on the Youth Advisory Board.
Excellent. And last but not least, Lori.
Hi, everyone. I'm Lori Cassidy Murphy, and I am the Director of Development and Special Projects for the Medical Association of Georgia, which is also known as MAG. Since 2012, our Think About It initiative has provided information and resources to providers and patients on opioid misuse prevention. We also distributed thousands of naloxone kits to first responders years ago through our project DAN, Deaths Avoided by Naloxone. And we also have provided several prescription drug drop boxes around the state through college campuses and law enforcement offices.
Excellent. So again, we're very excited all of you are here. Let's get started having our dialogue. You can use the question and answer box, the Q&A box, to write any questions that you want answered by our panelists. The way this format's going to set up is we're going to start doing some ground setting work first, and then we'll get into asking some standard questions to our panelists, and then we're going to open up and answer your questions. So please use that question and answers box to put those questions in. And for our chat box, if you have any comments, you can throw it in there. Just make sure you select all panelists and attendees if you want everyone to see it. Keep all panelists if you just wanted to come to the panel with that. So to get started, Morgan is going to talk to us a little bit about what's going on with this opioid addiction and epidemic that's going on here. So Morgan, I've heard of this term Generation RX, and I heard Diana say she works with the Gen RX project. So what is Generation RX, and why is that significant?
So Generation RX is really, it's a collaborative partnership between Ohio State University and their College of Pharmacy and Cardinal Health Foundation, so we can educate people on the correct usage of their prescription drugs. So let's begin by establishing that prescription drugs are really beneficial to people. They help us live longer and healthier lives, and they help us with any symptoms that we might have when we have a disease or an illness. And they also help with preventing illnesses or curing illnesses that we have right now. But these are very powerful medications, and they can be very harmful and dangerous if they're used incorrectly. So our very important message here today is that you use your prescription medication when it is directed by a healthcare professional.
Excellent. Thank you for that overview of that prescription drugs can be helpful when used correctly by and directed under a professional giving that prescription to you. Can you tell us a little bit about misusing a medication and kind of the epidemic that we're currently in when it comes to prescription drug and opioid abuse?
So right now, with prescription drugs and becoming a bit of an epidemic, it can sometimes be a little difficult to understand how somebody might misuse it or when it is exactly misuse. So here on the screen, you see there are 3 scenarios that are prescription drug misuse. So one would be somebody is having really severe pain and they have pain medicine, so they take more than their doctor prescribed because they feel a lot of pain. And then the second would be a friend or family member is in pain and they're like, here, take my painkillers, they really help me. And the third would be, I'm gonna take it with some alcohol to help with the pain. So which one would you think would be prescription misuse? You can put it in the chat if you want.
So go ahead and use that, all panelists and attendees. Morgan said, which of the 3 scenarios do you think is prescription drug misuse of the 3 that she described? Amanda says, make sure you hit all panelists and attendees for that. Gregory says all of the above. All scenarios from Takoya. Excellent. Charlotte, all of the above. I think we have a very educated group here, Morgan.
So we do describe misuse of prescription drugs as seen in the previous slide above, all of the above. So just note that when you educate people.
We're losing you a little bit, Morgan. If you could speak up just a little bit for us, please.
I don't know if it's my internet or what's happening, but okay. So next, so we do see this as a bit of a problem with people misusing their medications. Okay. And so unfortunately, the CDC does see this as an epidemic. And so Americans have misused their prescription medication and they use it differently than what their doctor may have prescribed them, or they have different intentions when they use it. And so thousands of people are doing this a day. And the most commonly, okay, never mind.
Sorry, go back.
Okay, so they're most commonly misused among all the drugs, including marijuana. Okay. So this does affect all of us, no matter what age group you're in, no matter where you're from. It impacts all of us very greatly. And the risk impact all of us as well. So why is our community so vulnerable to these prescription drugs? If you have any ideas, you can put it in the chat box.
So again, I'll remind you to make sure it says all panelists and attendees and on your to box. And the question is, why do you think our communities are so vulnerable to misuse of prescription drugs? Excellent. We've got healthcare access, social norms to take a pill to feel better, lack of information, easy access and pressure and stress facing our families and youth because of their addictive quality and the lack of awareness around their use. Excellent. Self-medicating, easy access, lack of education. Thank you.
Yeah, so all of those are correct. And so you all know the dangers that go into and how this happens. So now that we identified how this can happen, how does this misuse impact our community? And feel free to use the chat box.
How does the misuse impact our community? How have you seen, or what do y'all think? Higher healthcare cost, Chad says. Thank you, Chad. Addiction. Ferlin says addiction. Suicide from Margaret, a rise in crime from Gregory. Jonathan says increase of job loss. Mona says it tears families apart. Yes, excellent. Overdose and death with the overdose. Excellent.
Yeah, so all of these are really great examples of how the misuse of prescription drugs are really consequential to our community.
So we kind of talked about, you've given us the background of this and how it is affecting our communities and how it affects individuals. So there's good news, right? There's got to be some good news, right, Morgan? So can you tell us what we can do to fight this epidemic?
So there are many ways that you can help out in your community, but remember, so, right, so it's in the slides. You can use prescription drugs directed by your healthcare professional. And don't share your drugs with other people. Don't take somebody else's drugs. But keep your medication safe and make sure you model safe medication practice. So first, use prescription medication directed by your professional. Oh my God.
Yeah, speak up a little bit, yeah.
So use your medication when it's directed by your healthcare professional, because they know what they're doing and they know that this is the correct amount of dosage that you need because you're this tall and you weigh this much. So make sure you follow those directions clearly and don't take too much, don't take too little, because the medicine's there to be beneficial for you. And don't take somebody else's, because again, they may not be the same height as you. They may not weigh the same as you. They may have a different health background than you. So the medicine they have is for them to help them. And if you take it, it could have a completely different impact on you. And keep your medicine in a safe and secure place, because we often get prescription drugs because they were around the house. You get them from like a family or friendly member. So if you keep your medicine in like a lockbox or in a locked cabinet somewhere in your house, that way people can't get into your drugs as easily. And so what do you do when you have some leftover medication, but you no longer need it, so you can dispose of it correctly? And there are prescription drop boxes, and you can always look them up and see where they are in your community and drop off of your leftover prescriptions. Or you can take them to Prescription Take Back Day and they will correctly dispose of it for you, which is very helpful. Or if you notice there's not really a prescription drug box near you or the take back program, you want to dispose of it yourself, you can. So it would be by removing the pills from the container and removing that label and putting it in dirt or cat litter, right? And then putting it into a little like Ziploc baggie and then putting it in the trash and then disposing of the pill bottle container. And then model safe medication practices, because you want to set a good example for your community. And so you can do that by discussing the dangers of misuse with friends and family. And then the last thing you can do to really take action on this epidemic is to educate others in your community and tell them about the dangers and spread awareness.
All right, thank you, Morgan, for that. And we appreciate your time kind of level setting and getting us all on the same page. So now we're gonna go turn to the panelists and give Morgan a chance to breathe. There's a lot of presenting there, so thank you very much with that. So panelists, I'm wondering what it looks like in our community. Like, what do you see with the drug abuse in our community? And I'm gonna start with Diana, because I know you work specifically with our community members here in Gwinnett.
Yes, exactly. Something that I'm seeing a lot is the lack of education. So many of you actually mentioned lack of awareness, lack of education, and something that I'm experiencing is when I'm going to different sectors in the community, schools, churches, business, and educate them about what is the consequences of prescription drugs, not only physical consequences, but legal consequences as well, okay? How to, the proper story, what is the proper disposal of the medication. People definitely take more care of their medication at home, and they always keep more attention on their kids and what's going on around them in home. And that's another thing. When you educate adults, parents specifically, and you provide all this great information to them, you not only educate them as a parents or adults, you're educating the entire family. So they can bring all this information to their kids anyways. So they can establish conversations with the kids. So I'm seeing a lot of parents telling me, like after they receive a workshop or one of the workshops I give it to them, they had a conversation with their kids, and their kids actually, they open to talk about, wow, I have a friend that is having this and this issue, and I'm noticing that when we go into the house of whoever, he's taking more time in the bathroom. So now I'm gonna take more care about what's going on. So definitely when you educate the community, when you educate people, adults specifically, you're giving a lot to the community, and you are providing actually the tools for them specifically.
Excellent, thank you. And Amanda, you said you worked with Navigate Recovery and working with individuals and families in their road to fighting addiction and winning recovery for them. Can you tell us what you're seeing through your work in the community?
Sure, thank you. So at Navigate Recovery, we are a recovery community organization. So we are governed and led by people in long-term recovery, and we work with individuals and families. We see a lot of, we call them peers, so we see a lot of peers, individuals, and families that are either at their crisis moment, because we actually have a department that goes into the emergency room and meets people if they've overdosed or at a high risk. Or more often what I see at the actual center is I see a lot of family members that are calling, supporters that don't know what to do, and they don't know what step to take. So a lot of what we do is not just the support, but it's connecting individuals to resources that are in our community. you know, what we definitely see is that this kind of thing affects the entire family, whether you want to be a part of it or not. Everyone is involved. You know, there's no standing on the sidelines. It affects everybody. I mean, it affects job loss. We talked about for trouble in school, legal issues. And the really sad thing that we see a lot is accidental overdose, which sometimes does lead to death, or sometimes it's an overdose. Like I said, we meet individuals at the hospital. So a lot of what we see is people just seeking to educate themselves, kind of like what Diana was saying, because one thing I've noticed in my own experience is that I wasn't educated on a lot of things like family history, which I'm sure we'll get into that kind of stuff. But there's a lot of things that if you educate yourself, you can just be armed with knowledge to be able to take these things, you know, if you do need them, and you can take them the right way and you can dispose of them the right way, but it's just not something that we just know. So we see a lot of people affected in any way you can think of. And a lot of times it's you know, like I was saying, financial, job loss. It could be families being torn apart. Somebody in the chat was saying that. That's spot on. And so those are the kind of things that we see, is how one thing can affect everybody in the family. And that's a lot of what we see where I work. So.
Excellent. Thank you so much for that insight. Lori, you working with the Medical Association of Georgia, MAG. How is this, what's this look like with our medical providers and in our medical communities?
Right. Well, thanks everybody for this great opportunity to be here. And you all have done great work, what you're doing, and provided quite a foundation for me to explain kind of what goes on the provider side. As for the work of the Medical Association of Georgia and what affects our providers, typically happens at the Georgia Capitol and through the providers' national and statewide specialty societies. For instance, there's an American Association of Addiction Medicine. So there's also a Georgia chapter for that. There's, you know, an American Association of Pediatrics. So there's a Georgia chapter for that, and so on and so on. And so in pain management, the physicians are now dealing with a pendulum swing that's created a lack of balance in terms of some of the care that they're able to provide. You know, doctors want to help their patients. They want to help you. They want you to feel better. And when a doctor is dealing with a patient with something like pain, you know, each person's experience is unique. And, you know, thankfully, there's been an increase in the checking of the prescription drug monitoring program, statewide and nationwide. And the prescription drug monitoring program is a big database that the physicians can use to check on their patients and their medication and other types of notes that are important about their particular patients. It's run through the Department of Public Health and is a great resource. Physicians are now required to access that before they prescribe a Schedule II prescription drug. Through MAG's Think About It initiative, we've been able to equip our physicians and others with some printed materials, educational materials that we can offer them online and also in person or in their hand. It's kind of like a one-stop shop on different laws and mandates and requirements of a physician that they need to know, they need to keep up to date with in order to treat their patients correctly, legally, etc. There's information as to anything that a physician would need to know there, whether they're in a private practice or they're engaged in a health system like a WellStar or an Emory type health system. So that's kind of a little bit on the physician side.
Excellent. Thank you so much. And it sounds like we've talked a lot about the community, and we've talked about families, we've talked about the medical providers. So Morgan, going into your senior year at North Gwinnett High School, right? Go Bulldogs. Then can you give me what you're seeing in your schools and with youth?
Well, most youth don't actually use prescription drugs, and it's great because we're all very motivated to go and have the fullest of our future available to us. And so we're all very motivated and engaged in our futures. And when I work with Youth Advisory Board, it's just really great to be in collaboration with other youths who have the same type of morals and ideas, like, and we get to share and collaborate, and then we can bring those back to our schools and share and collaborate with our schools. Like, hey, I think we should do this presentation because it'd be really beneficial to incoming students. So it's really great to just be on these programs, and the youth all really want to do it.
Excellent. So it's great insight of that. We know the majority of youth aren't using or misusing prescription drugs, right? Using it without a prescription. And we live in Gwinnett County, and we know across the Gwinnett County Public Schools, Morgan and I were looking at stats on this, that there's only like 2,000, under 2,000 youth, but that's still 2,000 youth that misused. So we're still 3.3% of our Gwinnett County Public School students reported using without a prescription. We hope in any prevention world we'll get down to zero, because we know the younger they start, the more apt they might be to get an addiction and have to work with Navigate Recovery, such a great tool in our community. So thank you for all of that background. Amanda, we have a consensus here that there's a lot of things that are happening to those around us. And we hear a lot of times from parents that they didn't know that their kid was misusing a prescription drug, or they had no idea, or they were shocked. So do you have any advice for parents, what parents need to know, what they need to look for when working with their youth?
Sure. So, really the main thing is, I know it's hard anyway, because I have teenagers myself, but, changes in behaviors. Like, one major thing is if you see or notice that your youth is withdrawing from things that they're normally into, or not as motivated, things like that. Changes in behavior. I used to hate when my parents said this, but it's absolutely true. Like, check their friend group. Like, is there a friend group that, you kind of get that feeling, or if they're just changing their behaviors? Really, like changes in hygiene, things like that. Just when they start acting not themselves, or have sort of aggressive behavior when that's not normally the thing, or if, like I was saying, if they're kind of into something and then they just kind of lose motivation. I'm not into that anymore. I just, asking for money a lot, or money missing, things like that. These are signs that something probably is going on. That's kind of the major thing, is just their changes in behavior and hygiene and things like that. Obviously, if you find any kind of paraphernalia, it could be, they could be telling you it's for somebody else, but chances are pretty good that's not true. So things like that.
Excellent. Thank you for that. I think a lot of times when we're doing suicide prevention work or prevention work, that change of behavior is huge. But not to say that teenagers don't change behavior naturally, but it's a chance to clue in, right? It's saying, hey, I noticed this, why? Like, why did you choose to give up this sport? Was it that you hated the coach and that's a natural thing, and you have a different passion now? Or is there something more behind that I need to dig in? So thank you for kind of giving us that background of you notice it and you investigate when you see that. So excellent. So we know, Lori, when I'm working in the community with doctors and healthcare professionals here in Gwinnett, we have some great ones. There are times that opioids and prescription painkillers are needed to be prescribed in certain situations. And we're getting better with you talked about the PDMP and everything like that, and knowing the patient's history. But can you give an advice to our parents and our youth that if they are prescribed a prescription drug, how do they have that conversation, or what should they be talking to their doctor about?
Well, for an example, one of the samples of material that we have produced for patients, and these can also be found in patient waiting rooms, lobbies, et cetera, and Michael has all of these resources as well, are these leaflets that kind of go over some rules and guidelines to follow about storing your medicine correctly and that kind of thing, things that Diana covered earlier, and Morgan as well. But we put together a 10 question list that you can talk to your provider about, and it's very easy to read, very basic and understanding. You know, even if you were to take this in your own notebook with a couple of questions, having this helps you self-advocate, and that's extremely important when you are with your provider. It's your responsibility. Again, they want to take care of you, they want you to feel better, but when it comes to these kinds of things, like in terms of a prescription for an opioid, you've got to be careful with that and understand that as well. You know, a lot of times, and it happens to all of us, we can feel like the physician is hurried, like they are in a hurry, and their behavior can be extremely intimidating, that they're ready to get out of the office with you and move on to their next patient. Don't let them do that to you. You stand your ground and you ask the questions that are necessary. Even if it's, what is an opioid? Some people don't even understand what an opioid is and the dangers that could come with taking an opioid. Is it addictive? Get an understanding of what addiction is like. How could it be dangerous to me and my family? And in the situation, could the provider provide you a prescription for 5 or 10 pills instead of 30? Should you be getting a prescription for naloxone for this? Or can you tell me about naloxone? Those are all very valid questions to ask your provider, and they will have the answers for you. Have them explain how easy it is for them to explain to you how easy it is to store, and about disposing of medication safely and securely. Then the same rules apply for when you're visiting your dentist and your oral surgeon. As you know, most people are introduced to opioids under the care of a dentist, and this isn't meant to throw dentistry under the bus by any means. It's just a lot of times people are exposed to opioids the first time through having their wisdom teeth removed, and everybody, again, is different, and pain levels are going to be different for everyone. And so that's when you want to talk to your doctor about whether or not a Motrin or a Tylenol might suffice instead of an opioid.
Thank you. Those are some great tips, and we appreciate that. That don't let the doctor rush out of the room, because we probably have all experienced it sometimes where we think and we feel to the next patient, but to say, no, this is my time, like that. I need to have conversations. So thank you for that. You know, one thing, and Diana, you and I both work kind of in the community doing education around opioid and prescription drugs abuse. And something that kind of comes up is like, who is being affected by this epidemic? I think there's sometimes some misconceptions on who is being affected. So can you tell us a little bit about who you're seeing, or in your education and research, what you know?
Sure. Well, as Morgan mentioned it actually in the PowerPoint, everyone can be affected. You know, we are seeing kids, little kids, like 2-3 years old, and we're seeing elderly people, you know, 80s, 90s years old. So why? So we say, well, but why 2 or 3 year old is affected to it? Well, sometimes it's because if I'm taking a prescription medication, you know, and I forgot to lock it or put it away, and I left it somewhere when my 2 or 3 year old has easy access to get it. You know, for a 2 or 3 year old, they can understand, they don't see the difference between a candy and a pill, okay? And for 2 or 3 years old, remember that age, everything, they put everything in their mouth. So we're seeing a lot. It's something that very sad, but there's a lot of emergency room, how can I say that? There's a lot of emergencies that we're seeing overdose on these little kids. Okay, so they're going to emergency room because of overdose. So that's why affecting little kids. Usually, or the perception is teenagers are more affected to it because they're in the age of looking for different perspectives and their curiosity, right? But not always. As Dr. Murphy, Laurie said it, actually, you know, there's some prescription medication like opioids that if you're using for 5 days currently, you can be addicted to it. So if your doctor or your dentist provide you oxycodone or any opioid medication, you know, this pain medication, and you use it for more than 5 days, you can have the high risk to get addicted to it, not matter what age. So usually wisdom teeth, they're taking around 18, 17, 18 years old. But if you're like me, that I'm almost 40, well, I'm 40 actually, and I have to take one because I'm still have one. And my dentist told me, you have to take that too out. I was like, oh, really? Said yes. So I can get into it, you know, so that's a matter. What happened with elderlies? Elderlies, this population, they have to take a lot of medication. And most of the times, older people has a lot of pain. So they take in tons of medication. And sometimes because they have some memory issues as well, they sometimes forget. They forget if they took or not the medication, or if they forget the dosage of this medication. So they can have that higher risk of overdose as well, or get addicted to it. We have a lot of elderly actually that drinking alcohol, and they don't know, they have that lack of information that alcohol and your prescription medication is a bomb, you know, and they don't know about it. So that is something that we're seeing, that everybody, I'm sorry, can be affected, no matter your age, no matter if your ethnicity, because Hispanics wise, African Americans, everyone can be affected to it.
Excellent. Thank you for that. Right now in our society and our time, we're in the middle of this COVID-19 pandemic. So how is the pandemic affecting the epidemic, so to speak? What are you seeing this?
Well, I can say a little bit. Something that I'm seeing and I'm noticing is because people is in home all the time, you know, and they're not able to go out. They boring, you know, especially kids, they boring. So they look for something to do and they want to experiment. So we have, unfortunately, easy access to all these medications, okay? So there's a lot of kids that are starting abusing and misusing even their own medication because they want to do something different. They want to feel a little bit different, you know, instead of boring. What about if I try something different? So I'm noticing and I'm seeing some studies that actually the overdose of prescription medication is increasing right now. The misuse of prescription medication is increasing right now. So everything is increasing right now about prescription medication risk.
Excellent. Anybody else?
Yeah, I'd like to interject something in that it's incredibly sad how the numbers of relapse have increased tremendously over this time. And it's just a difficult time for people that have a predisposition for addiction. They're in isolation. Being in community is a huge aspect to recovery. And it's very difficult to do right now. However, there is a silver lining here and a little bit that has to do with the provider side, is that unfortunately there is a shortage of psychiatrists and mental health providers. However, SAMHSA has removed the barriers for treatment via telemedicine. So now physicians can treat throughout the United States, like a psychiatrist in Georgia can treat somebody in Arkansas, if they need help via telemedicine. It's been a huge gift during this time. It's because it's broken down the barriers of the use of telemedicine. Not that everybody has a computer and can use it, but we are finding that it's become very useful. And also I learned that people that are in 12-step programs or other type support groups are now using others in different states to see how their programs are being run, and being able to just see a different audience, so to speak. And again, just kind of widening that horizon of being able to at least be around people even though it's on the screen.
Excellent. I think that's great, Lori. Thank you for adding that, because I think we all hear, the rates are going up and the relapses are going up and all that. We don't hear the good stuff sometimes of that. This is really opening access to psychiatry care to maybe communities that didn't have it before. So that is something that is a positive for this. Anybody else want to add on to their experience?
I'll just kind of piggyback off of them. Being that I am in the recovery community and we are all about support and connection, it has been really a tough time, to be honest, because isolation, anxiety, depression, these are all like huge risk factors for setbacks, or as you might call it, a relapse. We call it a setback. Those, and also accidental overdose deaths, because people are isolated. All those feelings that we used to, mask with whatever, or we're feeling them, and a lot of times it's really even worse right now because there's so much fear and uncertainty, job loss, things like that. So unfortunately, yes, we are seeing a lot. Without like those same support systems in place, it's just been pretty hard. Now, kind of to say what Lori was saying, it's very true. So we have found so many other meetings that we've been able to share. When we were sheltered in place, we were able to show them meetings from all over the place. So you could, join to any kind of meeting that you were looking for, and just try to get that support. Another thing that kind of was affected too is that people were scared to go to the hospital because, and probably still are, because of COVID. And so that could cause a real problem for people who are using too much and maybe don't have Narcan, and that kind of thing. So there has been some, there's been a big rise in that, as we've all heard. It's definitely true, but also, as she said, it's nice that we're able to use the virtual options to meet people, to talk to doctors, to get support, that kind of thing. So, yeah.
I heard a speaker talk about positive, and kind of that resiliency is built on experience a lot of times, that when you've been through something hard and you can get through it. So a lot of times with our youth who have none of us have been through this epidemic before, but as we're older, we have more ability to recall on memories that it was difficult and we still made it through, and all that. So right now our youth are really struggling at some point because they don't have the experience behind their back to say we've went through something hard before, right? And this is difficult, but we have experience to kind of say we can keep going with that too. So reminding everyone that we've been through things are hard before, and it's helping both ways. So we're going to get to our final two scripted questions. I want to take this time to remind you that we do have the Q&A box. So hit that Q&A box. Put some questions in there that you want to ask the panelists, because after we get through these two, I'm going to turn to your questions and make sure they get answered for you today. So make sure you throw those question and answers in that box for us. So panelists, open to all of you. We've heard a lot this afternoon. You've talked about a lot. You've given us a lot of information, and we're aware of the dangers around prescription drug and opioid abuse and misuse. So from your perspective, what is the biggest challenge to addressing this issue? And whoever wants to go first, just raise your hand and I'll call on you and what is the biggest challenge? All right, so Lori.
Hi, I would just like to interject that there are still so many barriers that when it comes to care that need to be broken down. And especially as it's related to limited care and services that insurance will cover. So that's where someone who has a chronic disease and needs that ongoing care, they're not able to get it because their insurance is not covering it, or an alternative type of care like acupuncture or physical therapy. All of these protocols need to be expanded, and they need to be expanded in the jails, prisons, and wherever anyone needs ongoing care.
Awesome. And that's a great insight, Lori. When we're looking, our healthcare is part of a system too, right? You know, and there's some systemic injustice there with access to alternate care, access to regular care. So if you're in pain and you don't have access to physical therapy or something like that, the easy solution is to take a painkiller and just keep moving. And so I think that's definitely, as a society, we have to look at access to all healthcare and insurance to all healthcare, or when it comes to that. So great points there. Thank you so much. Anyone else? Okay, Diana.
Yeah, I can talk about in a community level. I can say denial and lack of awareness, definitely. Why I'm saying denial? Because even though that we know there is an epidemic and it's something going on around us, we always say, oh, that happened to them. That happened to my neighbor, but it's not about me. You know, that's not going to happen to me. That's not going to happen to my kids. Okay. And sometimes we, as a parents, we think that we have a lot of conversations about alcohol and drugs to our kids, but sometimes it's not enough. Okay, so that is a lack of awareness. Okay, I know of some families that they are telling me, well, I had those conversations with my kids. Now I have to go to look for a counselor because my son or my daughter is taking Xanax or is abusing their own ADHD medication, you know? So that is why we just not need to see what's going on in others, but let's check what's going on with our family, our own people.
Excellent. I love that. And also bringing in we're not just talking about opioids, prescription painkillers. We're talking about the prescription stimulants, the prescription anxiety medicine, all prescription medication. And I see there's a question coming in from Charlotte as well that we'll ask you in a little bit as well. Anybody else want to say what they think is the biggest challenge? All right. Excellent.
So I totally agree with what these ladies are saying. I mean, one of the biggest things that we find trying to connect our peers and families is affordable, quality care in our community. There's not enough of it. That's number one. But one of the things that we work on a lot, and why I do what I do, is to break stigma and shame. Addiction is a disease. It's like diabetes. And we're okay to talk to people about our diabetes. We're okay to do these things. Addiction has not been treated that way. And so I think if you ask me what one of the biggest barriers is or challenges, I would definitely say that it's that, you know, it's us as a community. We need to work on addressing this without making people feel ashamed, or just being able to talk about it, being able to walk in a place and say, hey, you know, just talk to someone and not think you're going to get whatever our peers think, that they're going to get arrested or they're going to get their kid, whatever the case may be, that you're going to get thrown out of your house if you know, it's not that. So the quality care and just breaking the stigma and shame, to me, are the biggest barriers that we see every single day.
Excellent. And I love that. I think we've talked about the individual, that kind of Diana talked about, the societal, and then we also talk about like this community of what is out there around you, of the stigma and the shame and the what you're hearing all around you through media and everything with that. So that's great. Thank you so much for that answer. Have anything for us, Morgan? Are you good?
Yeah, it's just like for me, like the youth and like getting more youth to listen and reaching more youth for me would be like a big challenge, because before I was on YAB, I had no idea about all these presentations, about all the events that really encourage people to correctly use their drugs, or like, this is how you correctly get rid of your drugs. And I didn't know about all the events that were happening. So I think if more people knew about the events that were happening in their community, they would go to it and get more education on the matter.
Excellent. I think that's a big thing that we always talk about. How do you get more youth involved? How do you reach the youth? How do you get them put on things that they want to go to and they learn, and everything like that? So definitely, thank you. So kind of on the flip side of that, what solutions do you see having the best or biggest impacts? And I'll open that up to all of you as well.
Well, I can show you some that actually I have it with me. First one is this. That's the box. It's just a box, you know, it's a safety drop box that you can have it at home. This is one of many that you can find it at, you know, different grocery stores, definitely, and pharmacies. You know, they have different colors, different sizes, different styles. Also, I want to show you this. I don't know if you can see it. This is bottle of pills, but it has, you can put your own code on it, you know. So this is something that you can find in pharmacies as well, you know. Sometimes I'm seeing in some Walmarts, not all of them, but sometimes you can have it there. Also, we have this and this. This is like a solution, you know, it's like a powder that you put inside and mix it with water. Or you can put it in here when you mix it, the same water, and you put in your pills in this bag, actually, and throw it away. That's it. And this kind of stuff, actually, when you're going to your pharmacy and you have any prescription medication like opioids medication, you can ask your pharmacist for this kind of stuff. Some pharmacies, they provide it for free. Some pharmacies, you may have to pay something, but it's not too much. But most of the time, like Walmart, Publix, Kroger, I'm not sure if CVS and Walgreens as well, but they have something like this one, a small one, actually, this RX disposal, and they have it for free.
Excellent. Wonderful. Thank you for showing all those tools. And as Diana said, as someone who has went into pharmacies to look for those things, to see where they are, you might have to ask the pharmacist or the associate, where is it? Because it might be on the bottom shelf somewhere with collecting dust, but the more we get them out in the community, the better with that. So thank you for that. What other solutions?
And also, if I could just add, also, it's especially important right now because so many people can't leave the house or don't want to leave their homes to go to a disposal site. So those are great examples, and we're working on that as well. Other things that I was just going to say is that, you know, we're trying to do everything we can to hold the insurance companies responsible to pay for alternative care and continuation of care. That's an ongoing thing that MAG works on. And then there's new medications that are coming out, from what I understand, that help with cravings. So that's another positive that's on the horizon.
Excellent. Thank you. Amanda?
So yeah, I kind of the same thing. I think the biggest thing is just arming yourself with knowledge, having a conversation. I know I do. I have life experience, so you know I have the conversation with my children. Like, listen, we have family history of certain things that make you at a high risk of just, you know, dabbling in this or that or trying it. Because I've been a kid and I get it, but you know, I think if you just arm them with knowledge, have a real conversation, you know, I'm not accusing you. I'm just saying, this is what I know. This is my experience, you know, advocating. We talk a lot on our advisory board about advocating for your family, knowing that family history, knowing, you know, just explaining to them, you know, when I was growing up, it was a lot of just don't do drugs. Like, here's your brain and here's, you know, your brain on drugs. And it, you know, that was, I don't know if that really stuck, really hard, but just being real about it, just having that real conversation. I think that knowledge, I mean, it's come up probably from everyone today, just, having as much education as we can, and just knowing that, hey, this is life and we can live life, as we say, on life's terms, but just to be aware of certain things to protect yourself. And I just think that's probably the biggest thing, because even as an adult, I didn't understand any of that. I didn't understand what my particular family history might have made me more susceptible to. I didn't understand how being prescribed medication for my chronic pain could cause me to become dependent on it. And I'm an intelligent person, and I did not know that. So these are things that I think will change, could actually help if we just can really talk about it.
Absolutely. And Morgan, from your job, your work on YAP, you've been on YAP for a couple years. Do you see, what do you think has some of the biggest impacts?
I think like the biggest impacts come from us just going out into the community, and you can kind of see with their parents or with their kids, and you tell them the information, they're going, oh, I didn't know that either. This was really great and beneficial for me as well as for my kid. And so everyone in the family really gets the education that we're talking about. And they also get to know about the disposal practices, which we're also talking about. And they get to take that information, and hopefully they tell other people about it. And more people come to our event next year to get more education.
Excellent. So going on in the community, thank you all. We're coming up on an hour, and we realize that some people might have to leave us, but we are going to hit your questions. We already have 2 questions in queue, and we'll have more. So we still on for another hour and a half, but our evaluations are very important to us. We have another 30 minutes, not an hour and a half more, sorry. No, don't freak out, folks, right now. So please, that gives you, if you QR scan that or do the bit.ly at the bottom, please do the evaluation. Also, Diana held up that beautiful lockbox, and she and Viewpoint have donated the two lock boxes that we're going to select from people that do fill out that survey. It asks for your email address. And so if you are selected, we will email you and say, hey, we would like to ship you this lockbox so you can have it in your home and use in your house. So please fill out that evaluation for us. Make sure you add more questions that you have from that. So starting back with the questions to our panelists. The first was asked by Gregory, and it says, if your child was prescribed pain medication, do you recommend using it? How else would you manage their pain? So that's open to the group.
I tried to explain a little bit that when it comes to prescribing, it's just it's a unique situation, and if it's having your wisdom teeth pulled compared to a broken collarbone, those are 2 totally different areas of the body that are in pain, and so it just my message, and I know that physicians also agree with this, is that it's important that you don't prolong the use of the medication. If a child is still in pain after 30 days or 20 days of taking a pain med, there's something else wrong. So they need to get back to the doctor and see what's going on, if it's not healed correctly or if there's an infection. But the longer you're on, the more dire it is. It's just important to get off those meds as soon as you can.
Anyone want to add on?
I agree with her. The reason we have pain medication is because when we're in pain, our blood pressure rises. And so a lot of the reason why we take pain medication is because when you do that, you'll bleed more and things like that. So there very well may be reasons to take it. It's always just to, ask them, well, what else could they take instead of this? Or maybe like day 1, they might need this to sleep and get through the strongest amount of pain if they had an injury or the teeth or whatever. But just what else could we take instead? And then just try that, like try the Tylenol or the ibuprofen, whatever they suggest. So, you hang on to it, and you just, maybe not give them, like it might say to take it for a week. They probably won't need it past day 1, you know, hopefully. So it's just that again is just advocating for them and saying, you know, I'm going to hang on to these. I'm going to give it to a, you know, if there's no other solution, if there is, we'll try the Tylenol and see how they do. And that's how I would manage my own children.
I think it's about, we talk about building a team, right? And Amanda said she serves and Diana serves on our guide prevention advisory board, specifically on prescription drug issues. And we talk about building a team and becoming a team with your doctor and a team with your teachers at school or the nurse at school or your a physical trainer if you're on a sports team. And just knowing that as a parent and a kid, talking to that doctor about what are the alternative use. And no doctors tell us all the time, it's for acute pain. So surgeries and breaks, it's acute short-term pain is the most effective for opioid prescription drugs for opioids. Other prescription drugs could be longer, right? You know, with that, but if they're not going to do physical therapy, if they're not doing the other stuff to get healed, then you have to have a better conversation about what's going to go on. So when you asked about alternatives, there's a lot of alternatives out there that people look for. They look at, you know, chiropractic or acupuncture, physical therapy. So there's a lot of issues. There's a lot of other things out there that you should know what is the right combination for your kid, and that can include or not medication, or maybe it is like opioid day 1 and then we're stepping down to Tylenol after that, you know, until you need it with that. But even if you are using an opioid or a prescription painkiller, using it on schedule as advised, and if your child's in pain, they're not going to remember. I mean, as a child, none of us remember when 4 hours went by, right? So they need that help of helping them remember. All right, no, you got 1 more hour before you get this next one, you know, or whatever it is, and you becoming part of that team of care. Okay, excellent. So Charlotte asked, in my opinion, Ritalin and other similar prescriptions that treat ADD and ADHD have been over school-age children. So what can us do to address this with parents and or prescribers?
I'll just say that what I tried to answer the question briefly, just that it's important that you just work with your provider and trying to come up with a solution. And I know this from personal experience. And it sometimes it just takes a while to find that perfect combination of meds. But I also agree with you in that it's overdone in certain circumstances. Again, it's that conversation, you know, that we've all talked about, and keeping those lines of communication open. And again, when you are with your doctor, because my son has a psychiatrist that his meetings with or appointments with my son were literally like 3 minutes long. And I felt this urge to just want to just sit there and ask him 300 questions because I wanted his attention. But he did whatever it was that we wanted, and he answered our questions. It's just, he saw it as a check-in, you know, how are we doing? But if it's more than that and the meds aren't working, you've got to try other things.
Yes, I want to also say that, yeah, definitely I agree. Something that I'm noticing a lot with the Hispanic kids, it's at school specifically, there's the counselors and teachers most of the time misdiagnose the Hispanic kids. I understand our Hispanic community or is part of our anxious, so I don't know, we talk too much. We talk with hands, with our eyes, with our feet, we move for everything, you know, and that is misunderstanding, you know. There's a lot of teachers that they think that we have a DHD problem. No, we're not, we're just like that. So I'm noticing and I'm seeing a lot of parents asking me like, you know, the teacher, that they're very worried about it. Like the teacher is telling me that I need to give prescription medication for the ADHD to my kid. Like, wait a minute, you know, or even pediatricians, you know, if you're pediatrician, in the case of the Hispanic community, I'm always telling them, try that your pediatrician be Hispanic or cultural competent, you know, like know very well about our culture, you know. Why? Because sometimes our pediatricians, because they can, of course, they can prescribe this medication, they provide this medication without a psychological and psychiatric evaluation. So sometimes that, or something that I'm mentioning to my parents all the time is, if your pediatrician or the school is telling you that your kid needs this kind of medication, go and get a psychological evaluation first. Okay, I love pediatrician. My pediatrician, she is Brazilian. Well, not mine, my son's actually. She is Brazilian, you know, but she is still actually, because that happened to my son, she still get some medication for my son without an evaluation. I was like, wait a minute, I'm working with mental health. So I know my son needs an evaluation first, but I know that because I work with mental health clinic. But what about those parents that they don't have any clue about it? So always, no matter if the doctor, the pediatrician says that this child needs this medication, definitely the correct thing is go and get a psychological, psychiatric evaluation.
Excellent. I think there's a lot of, to remember with all of our health, a second opinion is always okay, right? That you owe it to yourself, because doctors are great tools, great professionals, great resources, and they're doing what they think is best, but they might, just like everything else, having a second set of eyes can help better your outcome or what is best, or just have a different knowledge. Just like anyone else, they read different articles, they read different, they stay up to date. And I think what Diana said was looking for that specialist if you have the ability to do so. Looking for that specialist that knows a little bit more than some of our family practitioners, whose job is to know a lot about you know, a lot about that, but then people do specialize on that. So, excellent. So a little bit earlier, Amanda, you mentioned Narcan, and Lori mentioned naloxone. Does anybody want to tell us what that is and how people get it? Anything like that?
Sure, I'll say a little bit. They're the same thing, but they reverse an opioid overdose. And so we actually give it away for free at Navigate Recovery. All we require is that someone just be trained on how to use it, and that takes 10 minutes. But it's always, I have it in my car. You know, you never know like where you're going to be, you know, and somebody might need it. But if someone is, you suspect that they're having an overdose, and there's nasal and there's also an injection, it'll reverse it. So that's basically what it is. It's just something that it saves lives, honestly. And one thing I always tell individuals when I train them on it is, if you suspect that they're having an opioid overdose and they're not, and you give it to them, it's not going to hurt them. So it's like, that's the best part about it. So it's not like you're going to, you know, hurt somebody even more. But I know that we offer it for free. Some places do. And Lori can tell you a little bit more about that as well.
Yeah, you've pretty much summed it up, Amanda, and that the only other thing I could add is just that you bring that up with your physician if he or she does prescribe an opioid for you or a loved one, just so that you could have that on hand if by chance someone who it was not intended for got a hold of it and took that opioid by accident. And so that's where the naloxone comes in very handy. And again, it won't hurt you if it's used incorrectly, if you will. So But just, again, it's part of those questions to ask your physician and bring it up, because they're also learning new things to talk to their patients about. And naloxone has been used for years and years and years in surgery, but not like this. And so this is all a matter of turning a very large ship around, that we're doing it. It's just sometimes the physicians need a little bit of a push, and that's where it's good for us to come in and, again, self-advocate by saying, do you think I need this naloxone drug since I'm being prescribed OxyContin? So just keep that in mind.
Excellent. And a follow-up to that, and since Amanda, you said you train people on how to use Narcan, Charlotte says, I understand it's pretty simple. However, is there a certification required to educate others on how to?
No, there's no certification required. It's just really showing you how to do it, like, you know, how to inject it, if it's comes in injectable, or how to properly, because the nasal one, you would put it in the nose, but there's certain things like you want to keep their head tilted back because you don't want it to run all out or it's not going to work. But you don't have to have a certification at all. It's just, we just want to, you know, train you on it and put it in your hand, and then you're good to go. In fact, all of the kits that we have, and I think that most individuals have, has easy peasy pictures, you know, like very simple, elementary, how to do it. And of course, you know, it always tells you to call like 911 while you're doing it and tell them that you're doing it. So they'll walk you through it as well, but there's no certification. It's really just, someone just needs to tell you how to do it, show you, and it's very, very simple.
I know there is an app as well, 3 Steps to Save a Life, as well. They have an app for everything. So it's a free app that you can download that basically gives you the 3 steps, and it tells you how to use, you know, the first question is, do you suspect someone's having an overdose? Next, you know, it gives you that, is the person awake? You know, and it takes you, do you have naloxone on hand? So it gives you walks you right through as you're calling 911, if you have that as well. So, you know, call 911, don't run, right? That's the thing, save the lives. The last question I have, again, is targeted to Amanda really quickly. So let's say you notice that somebody is using, or there is an addiction to a prescription drug or any drug. What resources do we have? How do you go about getting someone help?
Sure. So that can look like a lot of different things. You know, one thing we always try to do is just like, I actually get a lot of calls from a family member first, because I think people are always ready for their person to get help before their person is. But one thing I always do is, I talk to them about recovery for family members because they need recovery too. But we just try to have a conversation. I mean, one of the cool things about Navigate Recovery is because we are peers, it's a real conversation. It's not, you know, so clinical, you know, at first. However, you know, we always, you know, try to get them in just to have that conversation. Or if it's over the phone or email, we will send them resources. Like Viewpoint is a big one that we always use. And, you know, because a lot of our peers are underinsured or, you know, have no insurance or whatever the case may be. And we just kind of try to have that conversation with them. As I mentioned, one of the departments that we have is called Lifeline, and Lifeline are emergency department coaches who actually meet people bedside at the hospital. We're not back in all the hospitals except for Eastside right now due to COVID, but we're still connecting virtually with people who want to talk to somebody about what recovery might look like. And we just simply have that conversation. We always say we don't know what's best for you, but we know what's best out there, because recovery is different for each of us. And so we just kind of tell them, you know, this is what's out there. If whatever they're looking for, we just try to make the connection, because, you know, as we say, the opposite of addiction is connection. And so just connecting with whatever that might be, whether it's a support group, whether it's you need detox, whether you feel like you need treatment, whatever the case may be. So we just try to have that conversation and arm them with, you know, the resources that are out there. And that's really where it all starts, is just kind of planting that seed that, you know, it's possible. Like, you know, recovery is very possible. There are millions of people walking around our county who are in recovery, and they're, you know, paying taxes and working and doing all those things. And it's just, letting them know that there is that hope, and then connecting them with what they're looking for. So.
Excellent. Thank you for that. If you're not lucky enough to be in Gwinnett and have Navigate Recovery right here in your backyard and Viewpoint Health, also look at what hospitals are around you. That's a great part, and call and get resources. Don't be afraid to call and say, you know, I don't feel comfortable in the hospital, but what other local agencies are there around? What other support groups? What other peer-based groups that are there? And you might have to look outside of your little town, or your city, but keep that in mind for that. So any last questions? I see none. So seeing no more questions from the audience, I'm gonna give last minute. Before we wrap this up, I wanna ask our panelists one more question. What are our next steps? We've talked a lot today about kind of prescription drug misuse and abuse. You've said what's working. What do you think the next step should be? How can we curb this epidemic in our community?
So I guess I'll start. I think I probably already said it like a few times, but just to hammer home that the biggest thing is to educate ourselves, educate our children, have conversations, you know, realize like it's not, you know, like breaking that stigma and shame, because it's not the person under the bridge anymore. It's people walking around, like we said, Diana mentioned, it's our grandparents who have arthritis and they've become addicted to their pain medication. It's the face of addiction is all around us. And so just breaking that stigma and just having that knowledge, making it okay for your youth to have that conversation with you without judgment, just to really have a real conversation. And I think that's where it starts, is just giving them the knowledge, you having the knowledge, the advocating, knowing what's out there in the community, and just accessing that. And I think to me, that would be the biggest change if we do all those things.
Excellent. Morgan?
I really do agree with everything that was said today about educating yourself, educating your loved ones, and is getting out there in the community to help kind of spread the word so that more people know, because I think, yeah, education is what needs to be done, because it's the lack of knowledge. Because like the parents, they're like, oh, I didn't know that either. And it's just really great to get that knowledge out there.
Excellent. Thanks. Diana?
Yeah, I think the key is education, definitely, and open our minds, definitely. Be open to learn, because as I mentioned it before, we have some denial, and we always think that is it's not my problem, it's someone else's problems, it's not gonna happen to me, it's happened to that other family because they have their issues or they have some blah, blah, blah. So it's open our minds and be open to learn.
Excellent. Lori?
Again, I'm just going to drive in the point about insurance companies, and a lot of this will happen on the federal level of the way our nation's politics work. However, it's important that you voice your ideas, opinions, ask questions to your senators and representatives about what they are doing, what their opinions are on insurance companies covering alternative care and continuation of care for people in recovery, people, you know, with the disease. So I just ask that you do that. There's a lot of, there's some huge advocates through the American Medical Association. Former president of the AMA, Patrice Harris, is from Georgia, and she actually has been working on substance abuse prevention for years, way before she was president. And she continues to advocate very strongly on a national level for this. So I just want you to know that you've got a lot of people behind you that have a lot of power too, that are fighting for you.
Excellent. I'm on to my little 2 cents at the end of, I was thinking the same thing as Lori, as we have to look at systemic change when it comes to access to healthcare. and what is covered and who gets treatment and who gets the treatment they deserve. That everyone needs the treatment, equity and the treatment that they deserve, no matter what background they're from. So I think we address the stigma issues of that it is okay to ask for help and get help when you need it, and that there's nothing wrong, that if you've had an addiction and you're in recovery, that's success, that's a victory, you know, and that's a journey. So I think we look at that of raising that up and looking at our healthcare systems and making sure the people that are voting in a way to open and continuing to do the PDMP. That was a huge success in Georgia. But also, what is your local community leaders doing to get healthcare providers into your community? How are they getting the mental health providers and helping mental health services grow and be active in your community? So it starts on every level, from your local commissioners and mayors to all the way up to the state government and into the federal government too. So advocating for change and access, changing access for everybody with that. So since there's no more questions, again, we want to thank you all for being here. Big thanks to all of our panelists, Lori, Diana, Morgan, and Amanda, and for Navigate Recovery, Viewpoint Health, and MAG for being here, and Morgan being here to represent our YAB, our Youth Advisory Board, and taking time out of her day too. So thank you so much for giving up be with us and choosing to be with us and having this conversation. We thank you all, and have a great day and take good care.